Welcome to the Aesthetics Health Hub. My name's Julia Ogilvie. I'm an advanced nurse practitioner working in medical aesthetics. I've been working in medical aesthetics for almost 16 years now. Come from a background of intensive care, cardiology, and medical and surgical. Today we're going to be talking about some myths in aesthetics. And Jill, we have Jill here as well. Jill.
My name's Jill Smith, and I'm also an aesthetics nurse practitioner and colleague of Julia. We've known each other for a number of years now, and I've been working in this sector since 2016, but I've been a qualified RGN since 1991. So you can do the maths and figure out how long I've been qualified for. I've worked in GP practice, intensive care. I've worked in the third sector, which was an interesting part of my career. Worked in the voluntary sector with very vulnerable young people, and then came back to the NHS and worked in the speciality of addictions, and left about 4 years ago to work in my practice full time, which I'm absolutely thoroughly enjoying.
So I think maybe before we go into the myths and how we can break them down, I think maybe start with a question that we've discussed in the past that we get asked quite a lot, because in the world of medical aesthetics now, it's legal to have treatment from 18 upwards. And I think we're noticing that we're getting older people coming, aren't we?
Oh, absolutely.
What is too old? What would you say is too old? Or do you think there is an age that we should put on it?
I don't. I mean, it obviously depends on the assessment of the individual, because as we age, we are, becoming probably, got more sort of health-related issues. We're maybe on some medication for that. We are, I guess, declining in health to some degree, but we are living longer and probably a little bit healthier lifestyles than previously. In terms of an age limit, I don't think there really needs to be an age limit as such, but it does very much depend on, the health of the individual
100%.
and the
mindset
assessment
as well.
Yeah. And, something that we've spoken about previously, and something that's really important, is about capacity as well, because we can go into a mental decline as we get older. And if an older individual is coming for treatments, us as medical practitioners, that's something we have to be really, really mindful of.
Absolutely.
About decision making. We've got, many, many years of experience between the two of us. So we do know some benchmarks and some key indicators to look out for, when considering somebody's capacity. So
I think within our consultation that we've developed through the years, which we have adjusted through the years, we have incorporated into that red flags, I would say, that would highlight things like that for us, and then we would delve more, wouldn't we, into the questioning.
And I think what's really important as well is, alongside capacity, is people's reason for coming for treatments. What is driving that decision? We know that social media, can have an influence.
Definitely, yeah.
I would suggest that social media probably has a bigger presence and influence on younger individuals.
Yeah, I think,
I think, sort of the middle age bracket and upwards, less so. I don't think they're using social media quite as readily as our younger generation. So I think the influences are very much different.
Yeah.
I see there's a disparity between, younger people coming for treatments and older people coming for treatments.
Yeah.
I don't know what you're...
I think what we're talking about is more the older person, how we don't think there's an upper age limit. And I totally agree with that. You know, I get women in their 70s, their 80s coming in. And I agree, there are certain considerations that you would incorporate into your decision making. But I think also at the other end of that, you know, people will say 18's far too young to be getting Botox or fillers or skin boosters or whatever.
Yeah.
Well, 18 as a number might sound too young, but you could have an 18-year-old who's had a crap life. You know, they've never looked after themselves. They've lived a stressful life. Their skin can be horrendous, whereas you can get a 18-year-old that comes in and they're absolutely flawless. So if you were looking at them and not considering their age, you would say, no, that 18-year-old that has had the crap life and never looked after themselves warrants treatment, you know, both mentally and physically, I think. So I think you're right. I don't think there should be an age apart from the legal age of 18.
Yeah.
I think you should be looking at that person holistically, both physically and mentally, before you agree or disagree to.
And I think it's very much a clinical decision.
Absolutely.
I had a lady in her 80s, 86-year-old, a couple of weeks ago, and she actually came with her daughter, who's in her 50s, and she had already had some treatments, very natural-looking treatments, very basic treatments. But they'd obviously had a discussion at home, and her mum had highlighted that she still loves her makeup. She still likes her lipstick. And she was noticing that her lipstick was bleeding, you know, into her, what we would call the smoker's lines or the barcode lines. And that was really annoying her. But that was really the only thing that was you know, niggling away. And it was her daughter that says, well, why don't we go along, have a consultation and ask the questions? And of course, the first thing she said was, am I too old for this? And, you know, I just, age is a number
If
to me.
it makes you feel better, why not?
Absolutely.
Why
Quite a
should
sprightly
age-
86-year-old, you know, who was still living, you know, her life to the full. She was going on holiday in a few weeks' time with her friends. So, you know, when you start to get a little bit more of a background as well, we had a discussion. You know, I told her all the complications that potentially could occur. We did an assessment, looked at her medication, what potentially might be the risk factors.
Yeah, as you would with any patient, really.
Yeah, absolutely. So, you know, we risk assessed the situation and, you know, provided her with all the information. She was very much looking for something that was very natural and very subtle. And I know that's, you know, what you do as well. I very much believe in a more natural, regenerative approach rather than the overfilling, you know, that we often see, especially with the younger ones, I would say.
Definitely.
So, you know, after kind of reassuring her from that perspective, it was a case of go away and have a think about it. You know, give yourself some time. And yeah, she came back and she got the treatment done, tolerated it really, really well.
Good.
And
She'd be delighted.
she got a lovely, subtle, but nice outcome. And she was so excited about going off and putting her lipstick on, you know, in a few days' time and then heading away for her holiday. And at 86, I must say that's the oldest, you know, lady that I've done any treatments on. But, you know, the delight on her face at the end of it, and just I could see what it had done for her, even in just that split second.
I think society is becoming more acceptable as well, that people do things for themselves, not for other people. And I mean, I remember working in chronic care, and the cut-off point was 70 for admission in there. You know, I'm maybe going back a number of years, but I'll be 70 in 4 years, and if I took a heart attack and couldn't get into, could you imagine what that would create now?
I know.
Do you know, it's like, no, not now.
It has to be, as you said, it has to be holistic. It has to be very much based on the individual that sat in front of you.
Definitely.
And risk assess the situation. And, you know, it's not just about keeping our patients safe. It's also about keeping us safe as practitioners.
Oh, definitely, yeah.
And saying no is very much part of
which we've both
what
done.
we do.
Yeah.
Yeah. And, you know,
done
I've done it quite a lot. You know, it's not just one-offs that you would maybe say no to.
Yeah.
And I think that is a very ethical approach.
I agree. And I think the other question that kind of leads into that, you know, you hear branded about is aesthetics is about looking fake.
Mm-hmm.
No, it's not about looking fake. Maybe if I went back 15 years ago.
Yeah.
Yeah. You know, even as practitioners, we would go to conferences and you would see the overfilled, you know, medics walking about as well. You don't see that now. It's more about regenerative medicine and keeping things naturally now, which is great.
And I think there's been a huge perception shift. And I think we may have seen that, you know, overfilled look more so with, you know, the boom in reality TV.
Yeah, yeah.
And, you know, that very kind of, you know, honed and toned body, you know, the hair extensions, elastic, and we still see that to some degree. And we still see
The
that.
pearly white horse teeth.
Yeah, with celebrities as well. And we seem to have that kind of, you're either, or it used to be overfilled, or you were very, very, very natural and didn't do anything. And now we've got this in-between stage at the moment where people are like, no, don't want to be overfilled, but I also don't want to age too quickly.
No. As I say to my patients is, it's not about making you look 20 years younger.
No, absolutely
it's
not.
It's about making you look good for your age. So you become ageless almost. And keeping things natural. You'll still have lines and wrinkles. You know, I can't eradicate them completely, but you'll look natural for your age.
Yeah.
But just fresher looking. And that's what most people come in and say, I just feel I look really tired and I want to look fresher and less tired. And that's what we can create really well, I think.
Yeah, and I think, you know, certainly for me, and where I get the most compliments, I guess, from people that come into my clinic is more about my skin.
Yeah.
You know, I don't mind having some lines and wrinkles. Yeah, I like a little bit of Botox. I don't do a lot of fillers. I've got very natural, full cheeks. But I do like a little bit of Botox in the forehead region. But skin is the thing that I probably work on the most.
Yeah.
So my home care products, having some in-clinic injectable treatments. I mean, I would normally go to one of my practitioner friends to do that. Sometimes we'll have a wee afternoon where we'll do some treatments on each other because we're very busy and sometimes we put ourselves...
We're always the last ones to get done.
Oh, God, absolutely. I'm, you know, behind in doing my skin boosting treatments. But that is where I get the most compliments is my skin.
Yeah.
And at 54, I think compared to some 54-year-olds who maybe haven't looked at their skin and home care, and people are still washing with soap and water and think that's...
And never using an SPF.
Yeah, absolutely. And I started using skincare only probably about 6 years ago. I was a Nivea girl before that because my mum used it, you know that, until I realised that actually
the importance,
the cells need much more than you know that particular brand, and with the education, started to understand what my skin needed and what the cells.
And you see the improvement using medical grade skincare. You see that improvement fairly quickly.
Yeah.
You know, within the first month, you see that. I mean, in our clinic, what we do is we we scan people, so we'll scan them, and then you can see the deeper layers, and then you can advise on whichever product is suitable for whatever's found on the scan. And then we start them on, like yourself, on the medical grade skincare. And then we get them back in 3 months' time.
But they notice the difference.
They do, even before you rescan them in 3 months. They'll maybe be in for the Botox in between that or whatever, and they'll say, what a difference in my skin. Same with skin boosters. I mean, just now we are huge fans of Hydromax, which is a skin booster. And the results that we're getting for using that, especially just now, in these winter months. So you're going out in the cold, then you're coming into the heat. It's like shockwave to your skin. So your skin becomes really dry. So Hydromax is an amazing skin booster, and it's a protocol of 3 treatments. And what a difference. And after the first treatment, when they come back in 3 weeks' time for their second treatment, they'll say, what a difference in my skin. We can't keep it on the shelves at this time of year. It's about definitely looking after your skin from your topical skincare, but also feeding the skin from
the inside
within.
And working from the inside out and the outside in.
Absolutely. The other thing that I think is really important is your gut health. It's true what they say, you are what you eat. And if you've got, yourself, if you've been away for the weekend and you've eaten crap and drank too much wine and you come back and you just feel sluggish and your skin looks dull. Whereas if you go back onto that healthy eating plan again, your skin looks amazing again. So
and water.
Water's a huge
Never underestimate the power of water.
I totally agree. Yep, absolutely.
So what about this? We started off with discussing the concept of growing old gracefully. I absolutely hate that comment.
Absolutely.
Because
why should we?
Growing old gracefully means
things
different things. Yeah, to different people.
We do things for ourselves. We don't do them for anyone else. So why should we accept we grow old gracefully? And no, it's not vanity. People come in.
Oh, that's another.
That's a huge, People come in and they'll say, they come in for that assessment to get treatment, and then they'll say, do you think I'm too old? Or do you think this is vain? I'm like, absolutely not. 100%. Life's too short. We're lucky to waking up every morning, so why would you not want to feel your best? So, no, definitely, 100%. What we do or what treatments we do in clinic should be for that person. And that's the other thing, we pick that up as well.
Yeah.
Because one of the questions I always ask is, say someone came in for lips and they were in their 70s, they say, why now? You've had those lips for 70 years. Why now? And that's when you usually get them saying, I've always hated my lips. But now at this age, I've got that little bit more money that I feel I want to spend it on myself and feel good about myself. And I think, good on you. Why not?
Well, I mean, life's a journey, isn't it? And
yeah,
we change and we grow, and our thinking changes and grows. As we get older, and what we thought in our 20s is not what we're going to necessarily think in our 30s and 40s and 50s.
No.
We're continually evolving. And, the other thing that you probably hear as well in clinic is a lot of people say, do you know what? I was that person that thought I would never get Botox and I would never get any skin treatments. I mean, people generally think Botox and fillers. And that's all aesthetics
And they don't know
is
the
about.
difference between them a lot of the time either.
Yeah, that as well. But they do not appreciate that actually that's not all that aesthetics is all about.
No, absolutely not.
That's a very, very narrow perception of what they're about. And, when I give one of my patients, my leaflet, or I direct them towards my booking page, and they say, oh my goodness, I didn't realise
You do that or you do this. Or,
what
yeah,
you do.
absolutely.
And that's why the consultation is really important, because that is your opportunity. I very, 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 very rarely will take a direct booking. And if I do take a direct booking, it's for a specific treatment. Because I do medical, like yourself as well. But for any of the injectable treatments in particular, or if somebody's needing their skin assessed, then consultation is absolutely key, because that's our opportunity to let them know that that and that are not your only options, that there's lots of other things to consider.
Exactly, yep.
And the treatment plan that they perhaps had in their head completely changes. But you need to give them a rationale for that.
Yeah,
They need to understand. And so that's obviously where the education comes in.
Definitely, yeah.
As well.
And you hear, the other thing that annoys me is you'll hear people comment, you know, oh, she's insecure. That's why she's getting that done. No.
I think we've become a bit more sure of who we are.
Exactly.
As we get older.
It's the opposite, I think.
Yeah.
It's not insecurity. It's you're feeling empowered. You're doing it for yourself. It's nothing to do with insecurity. Absolutely not. No. Totally. And yeah, but you do get people saying that.
And we get a lot of ladies in particular who come in and say, my husband doesn't know that I'm here today. My husband doesn't know that I'm going to have some treatments. Some of them do have treatments, and they'll have particular treatments to avoid being questioned, that they're maybe getting something done. And, you know, for me, that kind of validates the fact that they're doing it for themselves. They're not doing it for anyone else.
Exactly.
But then there's a question of, why do they feel that they can't discuss that with their partners or their colleagues or their friends or their family? And some will say, oh, my husband said, you don't need anything done. You look beautiful the way you are, which is lovely.
Yeah. And they probably do truly see that person as gorgeous as when they first met them, but it's still not about them. Well, I don't say it's not totally about them, because obviously they're going to consider them, but I think other things that come into play there are hormones as well, because, you know, most of my ladies are over 40. They're either perimenopausal or menopausal. So medically, you know, they're losing estrogen, their ovaries are shriveling up, they're losing progesterone, testosterone, and that in itself has a whole strain on the mental health.
But we're also seeing a lot of younger ladies that have been pushed into
menopause,
early menopause.
That's right.
You know, we've seen a significant rise in awareness of the likes of endometriosis and fibroids. And although ladies are fighting the system consistently, I don't know about you, but, you know, I'm hearing more and more ladies that have had hysterectomies, total hysterectomies, and they've had their ovaries removed as well.
And not really being well informed of or given the option. Some of them could have been given the option to keep their ovaries and just take the womb. But it's almost like, now we'll just do a full sweep there as well. You won't need them anyway. Excuse me, you know?
And not being counselled enough about hormone replacement therapy afterwards. And I had a lady in a couple of weeks ago, and she had her hysterectomy at 35. Now, her family was complete. She'd, you know, had her gynecological issues, and she had welcomed the surgery because it has changed her life in many ways. But in other ways, she is now without her hormones. And she is noticing more and more, you know, the changes in her skin and in her hair. And she probably coped with it initially fairly well, but now struggling and finding it quite difficult to advocate for, you know, the consideration for HRT. And I think that's that's a struggle for many of our ladies. But
they lose their identity, a lot of ladies going through menopause, and we've all been there, so we we have got the ability to have a voice on that, because there's not many ladies that haven't, at that age gone through menopause without some symptoms. And it's nice when you can give them back, as you say, that identity and that feeling good about themselves. And you see when they come back for their checkup, they come in that door and, whereas they came in and the head was low and the shoulders were forward, they come in and they're all dressed.
Their eyes are sparkling and they put their hair done or whatever.
Yeah.
It is nice to see that. But let's not forget our men.
Yeah.
Let's not forget them. I work with another agency who arrange blood tests for men. So I take the bloods and I do the phlebotomy for them. And I've only been doing it for about the past month, but it's all men coming in to get their bloods tested.
Testosterone deficiency, progesterone deficiencies,
all
absolutely.
All TRT. Every single gentleman that's come in my clinic of late, it's all been TRT. And the interesting thing about it is they're all obtaining their bloods through online providers. They've maybe tentatively mentioned it to the GPs, but they've just felt that they've been unable to advocate for themselves. And so they've been going to the online providers to get tested and also to get the replacement therapy as well. But these aren't older men.
No.
These are, I think the youngest was probably in their late 20s, early 30s.
I think they're in that generation as well where still men don't talk. Women, going through menopause, you've got your friends there, you'll talk about it, you'll sound off to them, or you'll have that really deep conversation with your bestie, whereas not all men, but I'd say a big percentage of men, when they're feeling low or if they're having symptoms like erectile dysfunction, they don't want to talk to their mates about it. Whereas if they did, they'd probably find a lot of their mates are having the same symptoms.
I think
they're embarrassed.
I think it's getting better though. And the couple of the men that have came in, a few of them have actually alluded to the fact that they have mentioned to, like maybe a work colleague or somebody at the gym, which I was a bit surprised with. But there are some conversations. Granted, there needs to be much more.
Definitely.
And it needs to be much more open. I think with the awareness campaigns round about the likes of prostate cancer and getting tested. I mean, we've been getting some more celebrities the past couple of days actually talking about it. I know Cliff Richard was talking about it yesterday, about having prostate cancer, and other gentlemen in the media. So every now and again we get these little spurts of awareness, and with that, I think men are now starting to consider not only their health, but also just generally how they're feeling about themselves. Because if their testosterone levels drop in particular, it affects their mental health, it affects their well-being. Their I guess the constructs of maleness.
Yeah.
The muscle strength as well. So there definitely
and it's amazing what you
some
can
changes.
What you can pick up on a routine blood. And people say, why would you pay for bloods? Why would you not? It's your health. Everybody knows it's difficult to get appointments just now with a GP. And a lot of the GPs, if you went in and you said, I'm just not feeling right, can't put my finger on it, da-da-da-da-da, they'll do routine bloods. Whereas we've got the time to sit, do a full medical consultation with them.
And you don't get 7 minutes.
Exactly.
You get a lot longer than that.
You'll get an hour. Sometimes it will run over an hour. And we pick out, right, that symptom. And then we can make those bloods bespoke to them, you know, and both men and women. And I think that's the biggest
face-to-face stuff
support.
comes in.
Yeah, I think that's the biggest support that we give them is changing their mindset and changing their thoughts and their emotions towards food, because most of us are emotional eaters. You know, you have a crap day, you open a bottle of wine, or you eat a box of chocolates. You have a good day, you celebrate with a bottle of wine and a box of chocolate. You know, we're emotional eaters. If you're feeling a bit down, comfort eat.
Or we're celebrating,
or,
with birthdays and things.
That's right.
We go out for some.
That's right.
To eat
So,
quite often.
yeah. So I think we can help manage these emotions and these thoughts round about food. And I hate the term, they talk about food noise. I hate that term. But it is quite descriptive. And you when you say it, you totally get it. But yeah, I think that's one of the biggest benefits is keeping an eye on their mental state and their thoughts round about food and be able to support that.
One of my ladies was in the other day, and she's quite a complex lady. Complex PTSD. She's just been diagnosed with ADHD. She has an extreme needle phobia, which was something that we had and we're working on still just now to combat. And she's got significant gynae complications and waiting for surgery. So getting her weight down is really, really important. She does work with a psychologist as well, but food and her relationship with food has always been an issue and has been an issue for quite a long time. She spoke to her gynecologist, she spoke to her psychologist, and going on to GPL1 was something that they supported with the right person. So we had a number of consultations before we even progressed with this. And to even get her over the threshold of getting onto the GPL1, had to do quite a bit of significant support work with her for trust, essentially.
Yeah.
And even our first administered dose, which I did our first couple of administered doses, and it was actually this lady went into a panic attack,
Shame.
and she was, but very embarrassed as well about how she was responding to it, and this fight and flight mechanism that was taking over her whole body that she was finding really, really difficult. I mean, I must say it was quite an extreme response, and I've not seen quite an extreme response to providing this medication before, but I knew I had the skills to be able to work with her and support her.
Everyone's different.
And get her through it. And she's now, a month down the line. She's still not self-medicating yet. Her partner helps with that. But we're making progress with it. Now, I've kind of digressed a little bit, but the point that I'm getting to is that we sometimes see people who are very, very complicated.
Vulnerable.
And complex. And, we're becoming more aware of, ADHD, people that are neurodiverse, sensory issues as well. And that's not just with weight management medication. No. I'm talking about even within clinic, if people are coming in for skin treatments or skin boosters. Now, because they have sensory issues doesn't necessarily mean that it's not for them. It's about how we approach that. And an awareness that people can respond to touch and certain treatments in a different way, and how we manage that and navigate that and assist them to get
even
through those
doing
treatments.
The consultation for these neurodiverse patients, you very quickly pick up, are they wanting an in-depth, want to know every single, thing that about whatever treatment? Are they looking for all the technicalities around it and all the research around it? Or do they just want give me the facts. This.
Yeah.
That, you know, that's me.
Yeah.
That's part of my ADHD. Just give me the facts. I don't want to listen to all that fluffiness round about it. I just need to know X, Y, and Z. That's fine. That's all the information I need, you know. So we pick that up.
Yeah, and just having a different approach
consultation.
with each individual. You know, and going back to that lady before we started, we did her bloods. And that for her was reassuring, although she's got needle phobia and, you know, she finds the whole medical process quite difficult, because of the way I approached it, and actually was able to pick up that she needed me to talk her through every step, as in, I'm just going to touch you here, I'm just going to do this, I'm not going to, you know, take your bloods at the moment, I'm just putting the tourniquet on, I'm just cleaning your skin. And she said that at the end, and she gave me that feedback, and she says, the reason you made that easier for me was because you talked me through it as you were doing it, and you didn't surprise me with anything.
Yeah.
You know, you didn't just stick the needle in. And she said real issues in the past with, you know, doctors, nurses, you know, people in the medical profession, just not picking up on that and not being aware of it.
Time constraint's a big thing.
But you're right.
Yeah.
You know, if you've only got a 5-minute window
you're not
to
going
take
pick
somebody's
up on
bloods,
that. No.
you know, you're straight
I think
in there.
because we don't have time constraints, I suppose we've put the care back into the caring profession.
Yeah, yeah.
Do you know, we can care. I mean, probably like yourself, like numerous other practitioners out there, you know, people come for a consultation. At the end of it, I wish I had a penny for every time someone said to me, I feel like I've just had a therapy session. You know, because we pick up on body language, you know, and we are more aware of our own body language as well. And so we can make them feel at ease just with the appropriate body language or the appropriate words that we're using or little nods of the head or whatever, do you know.
And just
shows we care.
Just our approach. And I think that's partly to do with us being nurses for as many years as we have been.
You've got life experience as well.
Yeah. And that, and you know, and I guess there's a personality thing there as well. It's also about just you as an individual. But certainly in our work, we have the luxury of time.
Yeah.
And time is a luxury in all aspects of our life. If we don't give the time, dedication to anything that we do, because we are a rush society, you know, we seem to, time doesn't seem to be on our side. You know, we're rushing from one thing to another, to another, to another. But for me, and probably for you as well, within our clinics, that's an area I've got control of. Leaving the NHS gave me that element of control back, where I could say, this is how long I'm going to make my appointments. I don't want to be rushing around. Maybe it's an age thing, I don't know. You know, I just want to be a little bit more chilled and relaxed.
Whether it's an age thing with us or not, it's still nice.
It's
to have that luxury of time.
Absolutely.
And you're given a service, you know, and they warrant a good service.
Yeah.
Why should they not?
And sometimes I see services that put stuff up on social media and they're like, I've done 40 Botoxes today. And you and I are sitting going,
really?
How can you even do that, you know, in clinic time?
Yeah.
You know, when you work out the preparation and the assessment and whatever.
It's not about quantity, it's about quality of service.
And sometimes you want to call out the BS on that.
Yeah, definitely.
But you're right. I would much rather have maybe 10, 14 appointments. The kind of higher end of the appointments is really some reviews in there as well. But I would rather have maybe 10 appointments in my full day so that I have the time.
Totally agree. And they don't feel rushed either.
Yes, absolutely.
And I
appreciate
think
it.
that ties into both our weight management clinics and any other clinic that we do, really. You know, it's not just giving that time for our weight management patients. It's about going back to what we spoke about in our last podcast, you know, about people coming in and feeling they're too old for treatments, or they don't deserve the treatments, or the people will think I'm fake. That, you know, no, we've got that time to sit with these people and break it down.
Yeah, and it's not about, you know, us and our colleagues persuading people to have something done. And, you know, sometimes people will come in and they'll say, right, I would like it done the now, or I'm wanting this, this, and this. And I would much rather sit, like you say, digest it, break it down, give all the information, work out a treatment plan, and do it over a period of time. Because I don't want that person going out of there and thinking, I've just been railroaded.
Exactly, yeah.
Actually, you know, I come in here, I've had a really shitty day. I kind of just wanted something, but wasn't quite sure what it was, and being persuaded to have this, and this done, and then regretting it.
Yeah.
You want your patients to leave being satisfied, not only with the service that they've got, that they've been listened to.
I'd say hopefully being satisfied, but then on the flip side of that, there are the patients that you get in and they're seeking constantly more treatment, and even though you explain to them, if I put any more on your cheek, you're going to look abnormal, or if I put any more on your lips, you're going to look abnormal.
Yeah.
And at the end of the day, whatever I do to you is my signature, you know, and I don't want you going out there looking fake. But these people have a different distorted perception of themselves. They do have a bit of body dysmorphia, which we've probably picked up, but we've been managing.
Or even dissatisfaction, not always necessarily
not always,
dysmorphia. And that could be due to life circumstances.
Yeah, absolutely. So I think having that uncomfortable conversation, saying, you know, we have got to the stage that if I start doing anything now, you're going to look abnormal, and I don't want you to look abnormal.
The proportions are just completely
and explaining that. And then some of them get that, and they're happy with that because you've been so honest. But you see that one or two that just never come back. And this actually happened to me last week, a lady that hadn't been back to us for a year, who got to the stage she just was never, she was going through a horrible divorce at the time, so a lot of that had a huge effect on her confidence. But she just was chasing every line, and it became the point that it would have looked abnormal. So we had that conversation, and in the face-to-face she seemed to accept it, but she never came back. And I saw a picture of her on Instagram just 2 days ago, and oh my God, her face is like a pillow. Whoever she's gone to has just blown up her cheeks. She's got tiny little, you know, the classic overfilled cheeks, tiny little
eyes.
slots. The bottom lip is disproportionate to the top lip, and I think, what a shame. What a shame, you know? And so I think we do have to accept as well that there are some patients that you will lose because you're being really honest with them. And for whatever reason...
But the majority will stay because you are.
100%, yeah. And I still would continue to have that honest conversation with some people. And yeah, you're right. That is a very, very small minority of these people. And these people tend to, whoever she's gone to now will probably have that same conversation with her. But she'll then jump and go somewhere else because she's never going to be happy with
interestingly enough, I had a message yesterday from a lady I haven't seen for about a year, 18 months, I think. And the message was, could you dissolve my lips?
Yeah.
I
I've
wish
had that
to
as
start
well. Yeah,
again.
exactly.
I
Yeah.
went to someone else,
I'm sorry.
and I'm not.
Will you take me
I'm
back?
not really happy with where they were, and I liked what you did at the time before I went to someone else. I mean, I haven't wholeheartedly agreed to do the dissolve just now because I need to have her in. I need to have a consultation. It would be useful to know what she's had done, you know, since she's been to see me, because she could have had a couple of treatments. Don't know what products in there. So I have to risk assess that situation. But there lies a little bit of a dilemma as well, doesn't there? Because these are people who trust us. And, do you know, I get it. People will go elsewhere. And that's okay, because we sometimes try things out and then decide, you know,
And it might have been
what's the best
quick
fit for us.
you know, flurry, a quick, in the moment
And there
decision.
could have been something going on for her at that time as well. And,
Exactly.
you know, regardless, the dilemma that we have, I guess, is that, yes, the trust has been established already. They've decided that they're coming back to us because they do trust us. But this is now someone else's work. And when we take on that responsibility,
Becomes ours.
to dissolve, because dissolving is not a frivolous treatment. I think that has become a misconception that, oh, if I get fillers in and if I don't like it, I can just go and get it dissolved, it's fine.
They've demedicalised it.
Yes. When we know that there can be complications of dissolve, we know that you can break down the natural hyaluronic acid in the tissues, and then the tissues become distorted and disabled, and it takes a long time for those tissues to repair. And we've also seen very, very rare but systemic issues with the dissolving agent as well. So it is about risk assessment. It is a medical treatment, but if I take that on, that becomes my potential risk.
Yep, definitely.
I would have less qualms if it was because of something that I done.
Yeah.
You know, and a treatment that required to be rectified, a complication or a very unsatisfactory
Because you know what
result.
products you've used.
Exactly.
Whereas someone else, you don't know which product.
It's a difficult one, isn't it? Really, because you want
to help them,
assess.
but you have to also. It's your registration at the end of the day as well, because as you say, the minute you lift that needle to dissolve it, that becomes your problem. Even although you didn't create it, you're then dissolving it, and that's a new issue. You know.
I know it's a tricky one.
It is. It's very hard, and
I think as nurses, as medics, you know, not just nurses, dentists, doctors, pharmacists, medical people do often want to
help.
It's kind of in our blood.
It is
to do that, but
absolutely.
There's also sometimes to say no to that as well, and that it may be another speciality that needs to look at us. It's tricky.
It is. It's very tricky. It is.
One.
Yeah, it is. It is.
But nice that people also want to come back and
And I think we've both taken many patients back over the years, and they come back with their heads between their tails, and you know, and that's fine. But yeah, we do need to take it seriously, and I don't think it's even like talking about highly has been, you know, the dissolving agent being demedicalised. I think the whole aesthetic industry has been demedicalised, and people think, you know, they can just price hop or, you know, wherever there's a deal on, go there and get whatever. They don't know what they're getting injected. If someone comes to you from another practitioner and you say to them, so what product did they use in your lips, or what product did they... They don't know. They never ask that question. And I always ask them to go back and ask the question before I take them on, because you need to know. Because if you've got to dissolve it, there are certain fillers as we
that
know,
are more difficult.
that are more difficult. So they need to be aware that I might not be able to, depending on what kind of filler it was, I might not be able to dissolve it. It might be in there for a long time and be stimulating collagen and elastin and making the matter worse as time goes on. So,
Well, hopefully, with regulations,
and they're not too far away,
which
hopefully.
is just round the corner, although they will need some tweaking as well. I expect what we perhaps are going to see next year, kind of mid next year, is not going to be the final, how it's all going to look. However, regulation, and that's we can have that discussion another day. Probably need a week for that one. But regulation will hopefully bring
Make a
about
difference.
accountability and
Regulate
safety.
standards across the board, so everybody knows there's a certain standard that they should only expect. And clinics they go to will not be able to drop below that standard, so they will get the best of care.
Yeah, absolutely. But I do think accountability is the biggest issue that we have, because if there's no accountability, there's no consequences.
That's right.
Then
Definitely.
people take unnecessary risks, and those unnecessary risks are driven by many factors. And unfortunately, the biggest one I would say is financial.
Definitely, yeah.
And not the person that's in front of them. They're prepared to take those risks and leave people in quite desperate situations.
Absolutely.
And very, very unsatisfactory results, and sometimes quite dire consequences. Due
as
to
we've
the risk
seen
taken.
recently on the news, absolutely. So, hopefully when that all tightens up next year, it'll be a better place for everyone, for us and for patients as well. Because I think I hate saying it, but patients need to take accountability as well.
Absolutely.
And do their homework before they agree to whatever. But unfortunately, as you said, a lot of them it's governed by price, not by what service am I getting here.
People are becoming more informed. I think people, we've had a lot going on in media. We've had a lot more discussions about what potentially could go wrong. There's a lot of scaremongering amongst a lot of that as well, and we're aware of that. But it's definitely raised awareness.
Definitely.
And, certainly from my observation, the people that are coming through the door are people who have done a bit of the research already, and they've come in and said, I've already been looking at you, I've been following you for quite a long time. I mean, I don't have a big social media presence by any means compared to some. I think that's a bit of a falseness as well. Some of the numbers that you see people have on social media as followers. People follow content that don't necessarily are your customers. But, reviews, word of mouth, reviews and word of mouth, I would say are kind of the biggest things. I don't know about you, but I always Google
Reviews,
a product,
definitely.
or, if I'm travelling, TripAdvisor, these kind of things. I always start to have a look at the reviews now, or it's word of mouth.
Yeah.
Somebody that I know that's been somewhere.
Yeah.
And that's reassuring. It's quite nice to hear as well. I'm not going to lie.
Yeah.
It's nice to hear that somebody else has recommended your service.
Yeah.
And not based on price.
Yeah.
It's based on
and I think
service delivery.
we like you said, we don't have a big social media, although we've now got Bulletproof on board, that our social media has improved greatly. But I think, the as you say, you can actually buy followers apparently on your social media. So quite sure there's a lot of people do that. They're not organic followers. And yeah, they can say anything on social media, and people, it's like, they use influencers, especially TikTok. It's the world's worst bit. They'll use influencers for skincare, for hairbrushes, for whatever. These people are getting paid for that.
I
Do you
know,
know?
I have
They're going to tell you all the shite of the day.
ever paid for or given a free treatment to an influencer
No.
to post on their
No.
social media.
Absolutely no.
Like, why would I?
Aye. Yeah. No. I think most of our people come from word of mouth. And I think that's the best way to get people. New people come, they get a treatment, they tell their friends, they tell their mum, their sisters, whatever. And then before you know it, you've got the whole family in. And I would much rather have that because it reinforces that you're doing a good job as well.
Yeah, and
that's nice to get that
organic
feedback.
It's been organic growth.
Yep.
Do you know, and in some ways, that's something to be quite proud of, because it's, you've put the work in, you've put the effort in. I mean, I don't know about you, but I was a very slow burn, into establishing my business because I wasn't targeting with the deep discounting and the really cheap fillers and the really cheap Botox and purchasing those very, very cheap items in order to be able to do that. It wasn't about getting the money in. It was more about the type of person that I wanted to attract to my service, because I had an idea of the type of service I wanted to give. And that was mainly, people that are considering their practitioner and value the service. Because I just think the service that I give is the service that I would want to receive for myself.
Absolutely.
And maybe that's about our own growth and development, that our expectations and our own values have increased over time, because we're beginning to appreciate and know our worth.
Exactly.
And I don't mean worth in business.
No.
I mean just worth as us, as people, as individuals, as mums, as partners, as, friends, as colleagues.
Yeah.
We start to get to that place. And that's the people that I wanted to bring to my service, that would appreciate having the time and not be rushed.
Yeah.
And
absolutely. No. Totally agree. Well,
anyway, it's been a fabulous discussion today.
So we've had another great session, which we do really well, chatting.
We digress. We do
digress. Yes, it's the neurodiverse brains in us. But hey-ho, you stuck with us to the end, so well done. And I've really enjoyed our chat, Well,
I think because, we've been friends for a while now.
Yeah.
And we've, I think, over the past year probably in particular, life has just got so busy. You've got the young grandchildren now. I've become a gran as well. Yeah. Life kind of takes over. So it is quite nice. We spoke about time earlier on, to have this time to sit and,
have that chat and
have that discussion,
absolutely.
Dissect what we do.
And I think for us as well, it kind of reinforces that we are doing things properly. Do you know? Because I think all practitioners doubt themselves at some point, whether it's because life gets in the way and they become really busy, or whether it's because you have a dip in, in business, and that happens to everybody. But I think just to have this little chat like this, it really helps just to reinforce that, we are doing things as they should be done. We are giving our patients a really good service.
For me, it kind of just reinforces and validates the passion for it.
Yeah, which we both have.
I, throughout my career, have moved jobs. You know, I've done loads, like yourself, you know, within the NHS. I think, again, the neurodiversity thing, once we started getting a little bit bored with you know, one speciality, oh, that looks good, in a way, in training that, or, you know,
That's right.
diversify a little bit.
Yeah.
And, you know, apart from my last job in addictions, which I really, really enjoyed as well, I stayed at that. That's the longest I've ever been in a job. But this is a job that I really enjoy.
It's like getting paid for a hobby.
I love the people that come through my door. The chat is always different. Sometimes we laugh, sometimes we cry, sometimes we put the world to right. Sometimes I overshare. Sometimes I need to hold back and learn to hold back. But sometimes that's not, because we're always told the NHS don't do that.
Thing.
But that also opens up discussion, makes you human.
Yeah.
And I think that's where
nice.
people connect. And I say a job, but it doesn't always feel like a job.
Yeah, definitely.
Yeah. And I think when we, you know, sit and have this discussion today, and whenever we talk about what we do, it just kind of
So I think
validates that.
I think
enjoyment.
Yeah, exactly. Absolutely. And probably just want to say thank you as well to everyone who's listened and got right to the end of our conversation. And it's been another great day.
Yeah.
Thanks, folks.